But without any further ado, Prince, over to you.
All right. Thank you so much. And can you see my screen?
Yes.
Excellent. Excellent. All right. Good day to everyone. It's a pleasure to be here. My name is Prince Ebenezer J. I am the regional coordinator for the AI for Global Health project under the Global Health Network and in Oxford. I'm also the AI team lead at the Global Health and Infectious Diseases Group in KCCR. KCCR is a research institution in the Kwame Nkrumah University of Science and Technology in Ghana, in West Africa. So that's where I am currently. And I'll be talking about advancing resilient health systems, equity, and the responsible use of AI in health by building a community of practice. That's what I'll be talking about today. Yeah, so I mean, AI is making a lot of waves. It's all over the news. And the truth is, it's here to stay, and it will have a profound impact on healthcare. And so the Artificial Intelligence for Global Health Research Project, or the AI for GH, is an initiative aimed at integrating AI into healthcare systems, especially within LMICs, but doing so in a very, very responsible way, right? The aim is to strengthen AI research, strengthen ethical deployment of AI technologies, and facilitate the sharing of knowledge amongst global health practitioners, particularly those in LMICs, for an emerging technology like artificial intelligence. There are several funders, two main funders, who are providing support for the AI for GH project. The first is the IDRC. IDRC actually took the lead in this area, so that was quite interesting. And they've also been joined now by the FCDO from the UK. The Global Health Network is convening the project, facilitating knowledge exchange, and I'll describe how we are doing that very soon. But we also work with another group known as Health AI, and they provide the resources for ensuring everything is done in a responsible and inclusive way. And the model of the funding is quite interesting. IDRC does not directly lend the grants to the innovators and the researchers carrying out the projects. They rather pass the grants to partners. We call them partners. And then these consortiums then do the sub-granting to grantees. And so some of those consortiums are the PHC, the HASH, the American University of Beirut, and IEC. So I'll give you a little detail about who these all are and what exactly they do. There's also York University and also Vilbro Africa. So this is how AI for GH looks like on a big scale. There are two major themes within AI for GH. What you see here as the brain, let's take the left side of the brain, focuses on sexual, reproductive, and maternal health, while the right side of the brain focuses on epidemic and pandemic prevention and preparedness response. The part on sexual, reproductive, and maternal health has about 4 partners or 4 consortiums. The first is HASH, the Hub for Artificial Intelligence in Sexual, Maternal, and Reproductive Health. That's the African Hub. And it's made up of IDI, the Institute for Disease Infection Study, Makerere University, and Sunbird AI. They make up HASH, and they have almost 10 sub-grantees under them. And then you have GAIN MENA. They are within the Middle East region, convened by the American University of Beirut. You have AI Sarosh. They are in Southeastern Asia. And then you have CLIAS, or the IECS. They are running the CLIAS project. They are in Latin America and the Caribbean region. And all of these focus on sexual, reproductive, and maternal health. Then for pandemic and epidemic prevention, you have the York University running what we call the AI for PEP project. They also in turn have about 15 subgrantees underneath them. Then you have joining these two themes to ensure sustainable, to ensure that the products developed can scale and they are sustainable. You have a commercialization team who mainly apply incubation and venture capitalist approach to ensure that the solutions produced are sustainable and they can scale. The hubs also cover the Latin America and the Caribbean, Africa, and Asia as well. So that's where you have Vilgro Africa, Vilgro Philippines, and Tech de Monterrey covering these three areas. And then you have at the base the Global Health Network, ensuring or creating a platform where knowledge can be exchanged across these diverse groups. You have us playing that role, connecting the two brains, and then you have Health AI also playing the role of ensuring that everything is done from design through deployment, through development to deployment is also done responsibly and inclusively. So that's the setup of AI for GH. Our role, like I mentioned, is more with facilitating knowledge exchange. And we do that through several ways. There are skill sharing workshops we organize and have organized. Then the flagship means by which we go about this is the Digital Knowledge Hub, which I'll be talking about very soon. Of course, there are several e-learning courses that we have also developed from the experience we've gathered facilitating knowledge exchange in this project as well. So we started off our facilitation by trying to understand what was missing, what didn't we have, what did we have, and we used a mixed methods study to conduct a scoping exercise that focused mainly on the consortium. So we tackled it from the consortium level, met with the consortiums, focus group discussions. Then we also did a desktop search where there were specific keywords that we consulted and came up with, and we found some very, very interesting things. We found, for instance, there were about 16 workshops that were available. And note, we constrained ourselves within the LMIC regions. These are about roughly some of the things that we found out with. About 40% of the resources we came across, or 42%, related to ethics. About just 12% related to sexual, maternal, and reproductive health. And also for developing on-the-fly AI application, we had about 30 or so resources. And so it's quite interesting. More details of this is available on our hub. Then to manage the large consortium, we also came up with a structure, an organogram, a working group structure, where we broke the groups into thematic areas: sexual reproductive health, commercialization, and a pandemic and epidemic working group. So what they do is that across the two brains, they are united by the themes they are working on. In addition to that, we had smaller teams that are doing several things to advance the project, including stakeholder engagement, defining what we mean by impact. And all of these together then report to a steering committee group, which is being finalized. The formation of that group is being finalized, and which in turn will also be reporting to, well, not directly reporting, but activities will be overseen by an advisory committee. This committee would be made up of funders and very big players within that space. So that's also something very exciting that we've been able to work on this project. In relation to capacity building, there's a very unique approach the Global Health Network uses. We work with regional coordinators, so that they can help to bridge global AI knowledge with local health needs. So for instance, I live in Africa, I live in Ghana. And so as a rep, I have a very good understanding of how the landscape looks like here. I have two other colleagues, one who lives in Latin America and Caribbean, and then another who lives in the Middle East. And so we coordinate the consortiums and subgroups events happening at the within the local and the regional level. And then when we meet, we are able to help identify ideas that are cross-cutting and help to push things forward. So essentially, the coordinators facilitate knowledge exchange between global AI experts, global AI needs, and then local healthcare needs. And like I mentioned, there's also a lot of workshops and skill sharing that has gone on. This is quite interesting. We noticed very earlier on that some of the groups that were working on AI were far advanced than others. For example, we had some groups in Africa that had done quite a lot of work. And so by harnessing the approach that we used, we were able to have those who had expertise, because most of the projects we found were based on specific AI technology, the LLM technology. So we had conferences and workshops where those who were far advanced could impart their knowledge and the skills they had acquired for the other regions that were now more or less starting along that line. And that was quite very interesting for us. Another very important consequence of this approach is that you have the individual institutions where the coordinators come from also build their capacities, right? So for example, I am from the Global Health the Global Health and Infectious Disease Group, like I mentioned, and working with TGH and on this project, we have been able to build a local AI team of expertise here, and we're going ahead to win grants, right? To win some grants in some AI work. And so there are similar stories that have also happened with the coordinating institutions, right? So that's a very also another interesting consequence of the approach we adapt. Then the flagship, the Knowledge Hub. So the Knowledge Hub is a central repository that provides open access AI training, ethical frameworks, and research materials. Interestingly, it's multilingual, right? You could have it in English, Spanish, French, and the few other languages we are working on. So that's how the hub looks like here. And you could visit the hub and have more details about the project. So essentially, the hub is like, shall I say, a personal assistant to the project. So as the project is unfolding, the hub follows along, gathers knowledge, synthesizes evidence, and all of that is put in the repository so that all the learnings that we accrue over the period of the project, you can find all of that in the hub. So when someone wants to go through a similar process, the person doesn't have to start from scratch. You just visit the hub and you can go through tried and tested processes. There's a very interesting feature about the hub. We call it the Connect and Collaborate tool. Essentially, you're able to visit the hub, then you add yourself and your expertise and what you do, and it is easy for other people to then subsequently find you. We can search by expertise, by region, and we can easily locate and facilitate coordination or collaboration in this case. The hub also is where we host the various resources. So what I'm showing here, for example, is the region from the Latin America and the Caribbean region. They have a technical paper on sexual maternal reproductive health they have produced as part of their work, and we have this here on the hub. Now, originally it was produced in Spanish, but we have local capacity to translate into other languages as well. So you would have it in English, you have it in Spanish, and you have it in French as well. And so that's quite exciting. So the hub really does have a lot of resources that help to build AI systems in a very ethical and responsible way, gleaned from the learnings of people who are actually building it and also aware of the regional nuances, right? So that's a very special place to find such resources. So in the future, we are looking at expanding the community of practice. We are looking to evaluate how the approach we have used. In fact, there's a slide I was supposed to show, right? Let's bring it. Don't look for it. But we are looking to strengthen the health policies and then provide ongoing support for the regional projects through the setup as we have it now. So I think I missed a slide. I'll just look for it and add it. But long story short, this is an overview of the AI for GH project and what we are currently doing in TGHN.